Hello, everyone. You're welcome to Akoko Africa Radio UK. We've been away for a while, but we are back here. And I'm sorry for our lateness. We had some technical issues here, but we are on now. Um, Today, we have Dr. Winfred Baah to come to talk to us about cholesterol. We've had him here last time and he was talking about asthma, and we are lucky to have him again now to do cholesterol. Doctor, we are very sorry for the lateness. We would like you to introduce yourself to our listeners. Some of them may know you, others may be, today may be the first time they are seeing you. So can you introduce yourself to us, please?
All right. Thank you very much. And my regards to our listeners. I want to also thank you for inviting me once again to share on these health issues with our listeners. My name is Dr. Winfred Baah. I'm a consultant physician at the Korletey Teaching Hospital in Accra, Ghana.
Mm-hmm.
And had some training in the UK as well. I had worked there for some time.
Oh, okay.
But I'm back in Ghana here, and I'm happy to join you this afternoon.
Oh, okay. Thank you very much. That when we called you, you came in. Thanks so much. So, we decided to talk about cholesterol today. We are already late, so we just start immediately. What would you say is cholesterol, Dr. Baah?
All right, thank you very much. I'm sure when it comes to cholesterol, everybody probably knows about it, at least the name.
Mm-hmm.
So when we say cholesterol, it's a waxy substance in the body, usually produced by the liver cells.
Mm-hmm.
And then it's carried by other things we call the lipoproteins into either back to the liver for destruction or to other parts of the body, including inside the blood vessels.
Okay.
So this cholesterol is not a bad thing.
Mm-hmm.
It is very useful. It is excess of certain parts of it that becomes bad.
Mm.
But cholesterol is needed by the body to produce the hormones. Most of the hormones that work in the body, you need cholesterol to produce them.
Okay.
Be it the female hormones, be it the hormones that control our blood pressure, be it different types of hormones, you need the cholesterol to produce those hormones. So cholesterol is a very important thing that the body needs. It is only when it is in excess or certain parts of it are in excess that it becomes bad to the body.
Oh, okay.
The body has a way of controlling it and a way of destroying. So like I said, mostly it's the liver cells. So we have different types of cholesterol. When you do your cholesterol test, you see that they've written total cholesterol, then they will write HDL cholesterol, then they will write LDL cholesterol, then they will write TG, triglycerides. All these are the different types of cholesterol.
Okay.
So the good one, what we say is the good cholesterol, is the HDL cholesterol. So when you look at your lab test, you will see HDL cholesterol. That one, rather, we want it to be high. So when that one is high, your doctors are happy because that is the what we call the lipoprotein that carries the bad cholesterol back into the liver for destruction. So if you have high levels of that one, it means that it will pick up the excess cholesterol that is not needed, and that will be this. So you don't have too high cholesterol. So that is protective, and that is the good cholesterol. So when you do your labs, you are expecting your HDL cholesterol to rather be high. So if that one is high, we are happy. The LDL cholesterol, the LDL is the carrier one that carries the cholesterol into the blood vessels, inside the lining of the blood vessels. And what happens is that when the cholesterol is like fat, you look at, let's say, a straw, and then you pour, say, oil in the straw. You see that some will get stuck in the lumen. And if you continue this process for a while, you see that inside the lumen of the straw, the space there will keep reducing because you have the oil getting stuck to the surface, to the lumen, to the inside of the straw. With time, the amount of water or drink that can pass through the straw will be reduced. Okay. And that's what the HDL cholesterol and the total cholesterol does. It gets into your blood vessels and then it gets deposited. And these things are not an event, it's a process. It happens over years. And so people are young and they say, oh, as for me, I'm too young to have high cholesterol. And then by the time you're 45 or 50, they say your cholesterol is high. And you say, at that time, rather, you are now checking your diet. It doesn't work like that. You have to start checking it from when you are younger because it starts building up over years.
Okay.
So the LDL cholesterol builds up it gets the cholesterol built up in your blood vessels. They form plaques. They can rupture. They form clots. So that is when, if it happens in the blood vessel around your heart, then you get a heart attack because then it gets to a level when enough blood is not able to pass through your blood vessel into your heart muscle. And then you get what we call myocardial infarction or heart attack. If it happens in the blood vessels that goes to your brain, so that enough blood is not able to get into your brain, then you get a stroke. As we know, we have two main types of stroke. We have what we call the infarctive, where the blood is not really going to the brain cells, so they die. That is the one that when you have the cholesterol blocking the blood vessel, then the blood is not able to get into the brain cells, and then they die, and it causes a stroke. Okay. The other type of stroke is when the blood vessel ruptures, it bursts. So that's not what we are talking about. So also, this LDL cholesterol can also build up in the blood vessels leading to in your leg. It can block it so that you don't have enough blood getting into your legs. And it causes what we call the peripheral artery disease, where you can see that some people get sores easily. The toes can get black, or when they get sore, it doesn't heal. Especially people with diabetes, doesn't heal easily. And then they will have to cut their legs. So that is it. So the total cholesterol is also bad. Then the triglycerides, they are carried by lipoprotein called VLDL. Okay. Now most of our labs do not measure that one. But if your triglycerides are also high, it gives you the same risk. So the only one that is protective, the good one, is the HDL cholesterol.
All right. So in a way, we say the LDL is the bad cholesterol and the HDL is the good cholesterol.
Yes. Okay. Also the triglycerides, the TG, triglycerides. And also when your total cholesterol is high, it's also a risk factor for all the things I've talked about.
Okay. All right. So why should one be concerned? I know you've spoken a bit about it, but why should one be concerned when let's say the bad cholesterol level is high?
All right. So we have to be concerned, like I said, because it can cause very serious conditions like heart attack, like stroke, like peripheral artery disease. In fact, even erectile dysfunction.
Okay.
It can cause that. It can even cause kidney issues because then the put you at risk of getting other conditions like hypertension, diabetes, or they coming together with hypertension and diabetes even puts you more at risk of other things. So that is why it is important to be aware of our cholesterol levels and to manage it.
All right. Okay, Dr. Ban, so what should be the right level of cholesterol when measured that we say is not a concern, or when should it be a concern?
All right. So the levels usually depend from lab to lab and from the units that are being used to calculate. But generally speaking, and also we also interpret the levels based on your risk factors.
Okay.
So if somebody has diabetes, your HDL cholesterol, we expect it to be less than 2.5.
Okay.
In fact, some will even say less than 2 to say that it's optimal for you. Meanwhile, in the general population, those without diabetes or kidney disease, we say that maybe if it's less than 3 millimole per liter, then it is okay. But generally speaking, you want your total cholesterol to be less than 5, your LDL less than 3, and if you have diabetes less than, or heart disease less than 2, your triglycerides must also cap that. Then you want your HDL to be greater than 1.5 or 2. And these are all units that generally is being used. But it's also important that you look at the lab and their reference points. But generally speaking, these are the levels. Your total cholesterol should be less than 5.
Okay. All right. Thank you very much. You are still listening to Akolko Africa Radio UK, and this is Health Talk with Na Atswei. We have Dr. Baah here, and we are talking about cholesterol today. So far, we've been taught what cholesterol is. Most people know that already, and we know the differences, the good ones and the bad ones, and the levels at which, when it gets to, should be a concern. Okay, Dr. Baah, can one lower the risk of heart attack by lowering the cholesterol level?
Yes, very important. It's very important to lower your cholesterol levels. If you do that, you will reduce significantly your risk of getting heart attack, your risk of getting a stroke, your risk of getting an amputation or peripheral artery disease. So it is very important to do things that will lower your cholesterol levels. And what are some of these things? Now, diet is very important. People who consume diets that have a lot of saturated fats, for example, red meat, then the egg yolk, they have a lot of the bad cholesterol in them. Okay. So the saturated fats. Usually we know cholesterol is mainly from animal products. So red meat, the egg yolk, cheese, and the rest, they have a lot of cholesterol. So it means that in your diet, you want to reduce as much as possible some of these diets that have a lot of saturated fats in them. So if you want to take, let's say, egg, you want to take more than 2 or 3 in a week, it will be better to maybe after the first or the second one, it will be good. The rest, it will be good to take the yolk out if you want to take more.
Okay.
Yes. And yes, so diet is important. It's also important that since we said it's mainly from animal products, it's also important that you increase your daily intake of vegetables.
Okay.
Of fruits, so the plant-based ones, fruits and vegetables. Increase your daily intake of those ones. they don't give you a lot of room to consume more of the diet. So like the fried things, fried yam, fried rice, and all of that. Chicken, especially the skin, has quite a lot of cholesterol in it. So once you increase your intake of fruits, vegetables, you have less space to take more of these things. The other thing is physical activity. Once you indulge a lot in physical activity, like exercise, we could be in several forms. It can be brisk walking, can be jogging, it can be moderate severe exercise, moderate intense exercise, can be gymming, it can be weightlifting, can be running, depending on how much your heart can take. It will be very important to engage in regular physical activity, which is exercise. We are saying that to have a very good heart life and reduce your cholesterol, when you are doing low to moderate intensity exercise, you should do about 150 minutes a week.
Okay.
Which means that if you are doing it 5 days a week, at least 30 minutes a day will be fine.
Okay.
And that if it's high intensity, then maybe about 90 minutes a week is fine. But physical activity, what it does is that it increases your HDL levels so that the bad cholesterol can be taken out of the body.
Okay.
And so it's very important to do your physical exercise activity. And checking your levels regularly. Like I said, even younger people can have high cholesterol. Yes. Even younger people can have high cholesterol. We have seen people with 20 years with high cholesterol. And let me also say that apart from diet and lifestyle, some are also genetic.
Yeah, I was going to ask you about that because yes, I have a friend with that.
Yes. So we have some that we call familial hypercholesterolemia. So for theirs, it's genetic. It's not mainly because of their lifestyle. They have certain genes that predispose them to having high cholesterol levels. So for those people, even right from when they are young, we start screening them and start treating them, because then it puts you at the risk of having a heart attack and stroke when you are very young. So for those people, even as young as 5 years, and we start screening them, we start following them. Or people with very strong family history, we start managing them or monitoring them right from when they are young. Okay, so it's also important that you know your family history, know if you have very high cholesterol in your family, and start checking early. You know, most people become health conscious or diet conscious maybe after 40 years.
Yes.
That is when you decide, okay, I don't want to eat junk. I want to be more health conscious. I want to eat healthy. And then you start eating healthy, and you go and check your cholesterol. They tell you it's high. And it's like, why? Now I don't eat junk. I don't eat late. Yes. So why? But you've forgotten that when you were younger, you started building it up. So like I said, it's not an event. It's a process, and it happens over years. So if you are young, it's still important that you check your cholesterol levels. It's still important that you become physically active and check your diet. Very important.
Okay, thank you. Would you say that is weight related? Would you say like people who are obese or heavyweight get cholesterol more than those who are not? Yeah.
Yes, so there are some people who are at risk of having high cholesterol. One group is the obese or overweight people. People who are overweight or obese are at high risk of having high cholesterol levels. There are people with certain diseases also have at risk. For example, there's a condition we call nephrotic syndrome. Your lipids will be high. The people who have diabetes, people who have hypertension, people who have kidney disease, they are at high risk of having high cholesterol levels. Okay, and then stress also predisposes you because it increases the level of your LDL. Okay. So stress predisposes you to have a high cholesterol levels. So reducing your stress levels is an important part of the management.
All right, thank you. If someone have high cholesterol and they have blood pressure as well, does it affect, like high blood pressure, does it affect their blood pressure, the high cholesterol?
Okay, so it's not like it will affect the high blood pressure, but having high cholesterol itself can predispose you to having high blood pressure.
Okay.
But when the two of them come together, then it even puts you more at risk of having the heart attacks, the strokes, and the peripheral artery disease I talked about.
Okay. All right. Thank you. We are still here on Akolko Africa Radio UK. We are listening to Dr. Baah on Health Talk with Atswei. It's 16. What's the time now? 52 or yeah. Dr. Baah is still here. Our next question to him, we want to know, apart from our health, like exercising and checking our diet and the rest, is there any medication that helps with managing cholesterol?
Yes, thank you. So when your cholesterol is high, the first thing we will tell you as doctors will be to one, what we call the lifestyle modification. And that's what I talked about, being exercise or increased physical activity, the right dietary management, reducing your stress levels, okay? But apart from that, we have medications that can bring down your cholesterol levels. We have several types of medications. The common one that we use is the statins. So here your doctor mentioning atorvastatin, rosuvastatin, pravastatin, and the rest. These are all used. We have other medications like ezetimibe. There are a number of medications, some are on trial. There are some people you give all of this, it doesn't come down. Especially those with familial hypercholesterol, those who have the genetic background, the genetic predisposition. In extreme cases, we can do something we call the apheresis, where we can get a machine to remove the bad LDL cholesterol from your blood. That is the extreme case. Extreme case, you can do apheresis for them. But generally, yes, the lifestyle modification and the other drugs work.
Okay. So among the medications that you've mentioned, the atorvastatin, rosuvastatin, and which one is the best among them?
Oh, they are all good. They are all good. And sometimes in certain special circumstances, some may be preferred than the other. But generally speaking, they are all good.
Okay, thank you. I know you've already talked about when we should start checking, but I was going to ask you, at what age should we start checking our cholesterol?
All right. So if you have the familial one, that one, even when you are born, from 2 years upwards, we start checking. Those with the genetic predisposition.
Okay.
And they have to be in a special clinic, we call the endocrine clinic, where they are being followed up. Otherwise, we said that if you are less than 20 years, you can check it once, and if it's fine, maybe every 5 years. If you are between 25 and 35, you check it, it's fine, you can do it every 2 years.
Okay.
If you are above 35, we advise that you check it every year.
Okay.
But in all of these, there may be special circumstances and considerations. And that your doctor will best be the person to tell you how often to check.
To check.
Because it also depends on your comorbidities, your risk factors, and generally how high they are.
Okay. So in regards to checking your cholesterol, where should you go, or how do you check it?
All right. So you can go to your GP, and usually they will check it for you. But these days there are also home kits that you can buy.
Okay.
There are home kits that you can buy, and then you'll be able to check, and the directions and everything is there. You can check, and they will tell you whether it's high or not. There are levels that you see. Okay. So yes, your GP is the best person to lead that. Usually, your GP will arrange those tests for you, and based on how high or how good it is, he will tell you when to come for the next test.
Okay. All right. So is there any symptom, if you have high cholesterol, something, is there any symptom that will make you alert to just go and see the doctor or anything?
Very good question. And probably one of the key things you should take out of here is that when your cholesterol is high, there are no symptoms.
Wow.
There will be no symptom. There will be no symptoms. So until you check, you cannot tell whether your cholesterol is high. Sometimes we can find some signs, something we call corneal accus. On your eye, you may see some deposits that look like fat. Then you may see, but by the time you get there, it means that it has been high for a long time. You don't even have to wait for that. So there are no symptoms, and until you check, you will not know.
Okay. All right. So with the medications that you've just mentioned, are there any side effects, and are they something that can be managed?
All right. Yeah. So just like any medication, there are side effects. But I must say that at the doses we are giving, generally they are safe.
Okay.
For the statins, there are a few side effects that are not seen commonly. In fact, there are a lot of people on statins and they don't have any problems.
Oh, okay.
But a few people may experience sometimes the liver enzymes may go high. But that one, once you let your doctor know, they can change it, or they'll reduce the dose, or will know what to do for you.
Oh, okay.
Then sometimes too, they can cause breakdown of muscle or muscle cells. So you may be feeling some weakness in the muscles. Sometimes you can have some muscle twitching. Okay. So those are some of the things that the statins can do. They are not common though, but it can happen.
Oh, okay. I asked that question because we had a patient that was switched from atorvastatin to rosuvastatin, and he came back that he's having some problems with that one, and I wanted to make sure whether sometimes it's in our mind because you are used to one particular medication, and when they switch you think like, no, I'm getting some side effects. So that's why I was asking.
Oh yes, it can happen.
Okay. All right. So listeners, that was my last question for Dr. Baah. We'll go online and see if we have any more questions for you, Dr. Baah, and give us a few minutes. We'll listen to a message from our sponsors. Thank you.
Hey there, fabulous folks. Are you ready to take your locks to new heights of beauty and vitality? Then listen up, because Tiny Hands Locks is here to make your hair dreams a reality. Located at the heart of natural beauty, Tiny Hands Locks isn't just a salon, it's a sanctuary where your locks are pampered and celebrated. Now, let's talk about our top-notch hair care services and products. At Tiny Hands Locks, we believe in the power of nature's bounty to nurture and revitalize your locks. At Tiny Hands Locks, we are dedicated to crafting bespoke lock styles that enhance your natural beauty and reflect your unique personality. From starter locks to locks maintenance, we've got you covered every step of the way. And when it comes to products, we've curated a range of natural wonders that are sure to leave your hair feeling pampered and rejuvenated. From clarifying shampoos to revitalizing conditioners, Each product is meticulously formulated with nature's finest ingredients to cleanse, nourish, and protect your locks. But wait, there's more. Visit our website at www.tinyhandslocks.co.uk to explore our full range of services and products. Located at 24 Swan Close, Feltham, TW13 6PA. Just give us a call at 0783 298 9531 and we'll take care of the rest. So what are you waiting for? Treat yourself to the luxury and care you deserve with Tiny Hands Locks. Because at Tiny Hands Locks, we're not just about hair, we're about empowering you to embrace your
Hello, Dr. Baah. Yeah, we are back. I got just a few questions here for you. Someone is asking, what is bad cholesterol?
That is the one that can cause problems for your heart, for your brain, and your body. Those ones are the ones, as I explained, can get deposited in your blood vessels and block it so that blood doesn't flow to some parts of your body. And that's why we say they are bad cholesterol.
Okay. All right. And the next one is they're still asking the difference between HDL and LDL cholesterol.
Okay. So like I said, the HDL cholesterol is the good cholesterol that we talk about. Because what that one does is that it takes the excess cholesterol, the HDL, which is also a carrier of the cholesterol. It binds to the excess cholesterol and takes it to the liver for destruction. So it keeps your body under check, keeps your cholesterol levels better. So that's why we said that one is the good cholesterol. The LDL cholesterol is the one that carries the cholesterol into your blood vessels and blocks them. So we call the LDL the bad cholesterol. So you want those ones to be reduced in your body as much as possible.
Okay. And the next one is, do we have like any particular food that we can get good cholesterol? As much as we get bad cholesterol from some of the foods, do we have some foods which has got good cholesterol?
All right, yes. So basically, as for the cholesterol, as you eat, especially from your animal products, you will get cholesterol in your body. But then, like we said, yes, so you can have some oils that are plant-based, and those ones will give you some good cholesterol. But most importantly, it is more about reducing your intake of foods that have the high saturated fats. Okay. High saturated fats, which I mentioned, like cheese, like the egg yolk, like the red meat, the fried foods. Those ones give you the high levels of cholesterol, which will be bad for your body.
How about avocado?
Yes, so there had always been the debate about avocado. Yes. Avocado is plant-based. So we expect that it should give you something that is a bit safer. But the only thing I'll say is that for all these things, it's all about moderation. It's all about moderation. It's all about taking them in good or reduced amounts so that you don't get excess of everything. Okay. So yes, you can take avocado. It's good, but we don't want it in excess.
Oh, okay. All right. That is the last of my questions. Before you leave us, have you got anything else to tell us or to summarize what we've come to learn today?
All right. So yes, thank you. I think that when it comes to cholesterol, it's very important that we know that even when you are young, your cholesterol can be high. So don't say I'm too young to have high cholesterol. Healthy eating must start from when you are young. If you are young and you do all the bad eating and you get to 40 and you think that you are now eating well, you would have built up the bad cholesterol in your body already. There's also the myth that if you are slim, you can't have high cholesterol. Only obese people have high cholesterol. It is not true.
Okay.
There are slim people with very high cholesterol. So it is important that everybody check. Don't say, as for me, I'm slim, so I cannot have high cholesterol. Or as for me, I'm too young to have high cholesterol. Please check and eat healthy, be physically active, and usually you have very controlled cholesterol levels throughout your life.
Okay. I've got another question just coming. This is from Joba. So everything excess can cause a disease, isn't it? Mr. Baah is asking if excess in everything can cause diseases.
That is a very broad question. If you say excess in everything, but I am just cautioning that yes, there's like the saying goes, too much of everything is bad. We said sleep is good, but if you are sleeping too much too is bad.
Yes.
So everything must be done in moderation. I think that is the key thing.
Okay. And someone else is asking, how does your body feel when you have high cholesterol?
Yes, like we said, your body will not feel anything unless it has been deposited and causing problems for your heart or your liver or your kidney or something else. Otherwise, if your cholesterol is high, you will not feel anything.
All right. So when cholesterol gets high, it can cause heart attack. It can cause stroke.
Yeah.
All right. Just a minute. No, I don't have any more questions here. Okay. There is another question. It said, does it affect men performance in bed?
Yes, so I said it. That you see, to be able to have good erection, you need to get, the penis have a lot of blood vessels on it.
Yes.
You can even see it when it's erected. You can see the veins on it. Now, if you have high cholesterol for years, it's not controlled. It can get deposited in some of the blood vessels, the arteries. And so you need, when you are erecting, you need a lot of blood to push into the penis. So if the thing is blocked and the space is only small, the blood that will go there will be small. So yes, it can. It's a risk factor for that.
Okay.
It doesn't mean that when your cholesterol is high, you cannot erect. No, I'm just saying that it's also a risk factor.
Okay.
Yes.
And can that be resolved by medication?
Well, like I said, I gave you the analogy of the straw, pouring oil in, or even your pipes, your sink, the pipe that leaks down. If you're always pouring things, the oil, it gets to a point, it gets blocked. You have to remove it.
Yep.
In the blood vessels, when there are plaques, or what we call atherosclerosis, then it becomes difficult to remove it with medication alone. So that is why when you have a heart attack, now they'll go and put some stent, something to open it, so that blood can flow. We call them stents in your blood vessel. So you don't even want to wait for that to happen because it becomes difficult to manage.
Okay. I guess that will be the last question. And thank you so much, Dr. Baah, for coming on the show today. This topic has been really, really helpful, and I hope all our listeners have learned something from it. We would like to see you soon again back here. I know you are very busy, but please try and make time for us once again whenever you are free, and then you come and educate. We really enjoyed this session, and anytime you come on. So thanks so much for your help, and we wish you a very, very nice weekend, all of us from Akoko Africa Radio UK. So bye for now, Dr. Baah.
Thank you very much, and my pleasure.
Thank you.
When it comes to balloons and balloons decoration for your baby Christian, for your ceiling floral, You Smile is the place to be. For your wedding setup, your beautiful wedding setup, backdrops, and everything when it comes to planning, coordinating, and delivery, You Smile is the best. For your indoor programs, for executive programs, for corporate events, You Smile is a place to be. Call on us and we shall give you the best of services. Our telephone numbers are 0242571571 and also 0243639381. Our social media handles are IG You Smile Events, on Facebook You Smile Events, and also on TikTok You Smile Events. Come and let's do business, and you never regret it. You Smile. Satisfaction is our hallmark. We'll make sure we deliver, and our delivery is always on point. When it comes to balloons and balloons decoration for your baby Christian, for your ceiling floral, You Smile is the place to be.
Hello, everyone. This is Atswei on Health Talk. Today, we're privileged to have Dr. Winfred Baah to come and talk to us about cholesterol. And we've learned so much about it today. Like he said in summary, we have the good cholesterol and the bad cholesterol. And then whenever your cholesterol is high, there are no symptoms, so you may not know. So it will be good to be checking it every now and then. You may not have any symptoms, like he said. So just make the habit of every now and then to check your cholesterol level. As we know, or as we've learned today, cholesterol can lead to so many things: stroke, heart attack, and we need you alive. So please check them. And if you are already aware and you are on medication, please try and take your medication regularly. Don't miss out and go for your checkups every now and then. Like he said, a little exercise, food, all those things go in a long way to help. And the men, you know what happens when your cholesterol is high. So we don't want to hear any stories. Please check your cholesterol. We've come to the end of the show today, and I have just a little thing to say. And it's like, celebrate your victories no matter how small they are. Whatever happens in your life, whether it's small or big, you don't have to wait for the big things in life before you celebrate. Because whenever you appreciate the little things, it opens door for the big things. Be happy, because where you are today, somebody wants to be there. I know we all have our aspirations. We want to be somewhere. We have plans. You are not there yet. But where you are now, someone wants to be there. And if you cast your mind back a few years ago, you were not at that position. So all the little things, all the little victories that comes our way, let's learn to celebrate and appreciate them. And when the bigger ones come, we can still go on to celebrate. Now, I thank you so much for all your time and for listening to us. Please, if you are not able to listen now, it will be on our pages, Facebook, YouTube, and you can always go back and listen. If you have any more questions, you can send to us on our website, WhatsApp, and we will respond to you. If you have any questions or any topics that are of any interest to you, let us know, and we are always at your service. We'll bring it to you. At this point, I want to thank you, and I want to thank my producer, DJ Kobe, for producing this program today. It was difficult from the beginning, but he managed it. And my script writer, Glennis. We even have to make her go to work late today because she has to help us with all our script and our technical issues. Thanks so much to Glennis, and thank everyone for being with us today. I will see you next week because I have another interesting topic coming on with our pharmacist Geraldine. And so please make time with us next week at the same time. From all of us here at Akoko Africa Radio UK, we say have a nice weekend and bye from us. Thank you.
When it comes to balloons and balloons decoration for your baby Christian, for your ceiling floral, You Smile is the place to be. For your wedding setup, your beautiful wedding setup, backdrops, and everything when it comes to planning, coordinating, and delivery, You Smile is the best. For your indoor programs, for executive programs, for corporate events, You Smile is a place to be. Call on us and we shall give you the best of services. Our telephone numbers are 0242571571.
Hey there, fabulous folks. Are you ready to take your locks to new heights of beauty and vitality? Then listen up, because Tiny Hands Locks is here to make your hair dreams a reality. Located at the heart of natural beauty, Tiny Hands Locks isn't just a salon, it's a sanctuary where your locks are pampered and celebrated. Now, let's talk about our top-notch hair care services and products. At Tiny Hands Locks, we believe in the power of nature's bounty to nurture and revitalize your locks. At Tiny Hands Locks, we are dedicated to crafting bespoke lock styles that enhance your natural beauty and reflect your unique personality. From starter locks to locks maintenance, we've got you covered every step of the way. And when it comes to products, we've curated a range of natural wonders that are sure to leave your hair feeling pampered and rejuvenated. From clarifying shampoos to revitalizing conditioners, each product is meticulously formulated with nature's finest ingredients to cleanse, nourish, and protect your locks. But wait, there's more. Visit our website at www.tinyhandslocks.co.uk to explore our full range of services and products. Located at 24 Swan Close, Feltham, TW13 6PA. Just give us a call at 0783 298 9531 and we'll take care of the rest. So what are you waiting for? Treat yourself to the luxury and care you deserve with Tiny Hands Locks. Because at Tiny
When it comes to balloons and balloons decoration for your baby Christian, for your ceiling floral, You Smile is the place to be. For your wedding setup, your beautiful wedding setup, backdrops, and everything when it comes to planning, coordinating, and delivery, You Smile is the best. For your indoor programs, for executive programs, for corporate events, You Smile is a place to be. Call on us and we shall give you the best of services. Our telephone numbers are 0242571571 and also 024363